So, Dr. Taberi, what is the best solution for postoperative stiffness and swelling?
So the question's about post-operative stiffness and swelling and what are the best ways to manage that. It's really two separate questions. Stiffness and swelling are not always related. So stiffness, I would say, probably the single thing that helps the most would be exercises to encourage range of motion. And that's probably true for hip as well as knee replacement, although it's generally thought of as being more critical for knee replacement. And whether that comes in the form of physical therapy or your self range of motion exercises, I think makes it extremely important. Even if you're actively enrolled in physical therapy, doing exercises on your own is really very important, because you cannot be in a physical therapist's office 7 days a week. And that's what it takes after having a knee replacement, is working consistently. It's just like getting in shape. If you go to the gym and you work harder than anyone in the world once a month, you're not going to be in shape. But if you do a pretty good job every day or every other day, on some consistent basis, you'll see results. And it's the same thing in recovery in terms of motion. For swelling, I'd say there's two most important things. There's all the stuff you can do to try to minimize your swelling, and those would be things like elevate the extremity above your heart, using compression early on, using ice, and then there's just time. Sometimes you just need time for that swelling to get better, and swelling is one of those things in some patients that takes almost longer than anything else to improve. So it's always a good idea, if you're worried about swelling, to bring that to your doctor's attention. But oftentimes, if I see a patient who has that concern, and if I'm not concerned, I'll just remind them that it's going to take some time, everything looks okay, and it's normal after these surgeries to have a fair amount of swelling.